Thank you, Chairman. Let me ask first to put into the record a letter from our governor in Rhode Island, which says that in Rhode Island, I'm quoting it here, we have actually seen exchange premiums decrease in 2 out of the last 3 years, and that this has saved consumers nearly $220 million since 2012. So the story on the Affordable Care Act in Rhode Island is actually quite a good one.
We put it in the record.
I'd also like to put this little graphic into the record, which, to explain it briefly, the red line along the top is the CBO estimate of where our health care costs were going to go back when they were making that estimate in 2010. And then at this time, 2016, after the ACA was in place, they took a look at the actual experience up to that point, and then they did a new projection going forward based on the Affordable Care Act. And just in the following 10 years, this green period from 2016 to 2026, they're forecasting $2.9 trillion in federal health care savings that relate back to the Affordable Care Act. This is where that came in. So we throw this thing out at our peril. If you care about saving Medicare, the savings to which are a very significant part of this $2.9 trillion, and we throw it out right now, according to the Republican plan, with nothing to replace it. I described that over the weekend at home as like being asked to jump out of an airplane with no parachute, but being told, trust you, we'll build the parachute before you hit the ground. I'm the junior senator to Jack Reed, who was an Army Ranger and actually did jump out of perfectly well operating aircraft. He insisted not on just one parachute, but 2, a spare. And I think the American people are entitled to know what they're going to be offered as an alternative. There's been some conversation in this hearing about how there are Republican ideas floating around, and sure there are Republican ideas floating around, but there's no Republican bill, there's no Republican plan, there's no Republican proposal. Our cards are up on the table. It's Obamacare. You want to improve it? Make suggestions. We've always been open to that. But on the other side of the table, there's nothing. And it's really hard to negotiate with nothing. And I think the Republicans have a responsibility to put a plan together. Now, we talked about that, Mr. Price, when you and I met in my office. And my recollection of our conversation is that you told me that you would want to keep letting people stay on their parents' policies until they're 26. Is that true?
I think that the insurance industry has included individuals up to the age of 26 on their parents' policies virtually across the board, and I don't see any reason that would change.
And you would want to keep, you told me, the donut hole closed to protect seniors against those pharmaceutical costs. Is that also true?
I think the discussion we had was about pharmaceutical costs and making certain that we did all we could so that seniors were able to afford the kind of drugs that they need.
My recollection was more specific than that you did not want to reopen the donut hole for seniors. Are you saying now that you're going to consider reopening the donut hole for seniors?
No, that's not what I'm saying at all. I think that it's important, you know well that the reopening of the donut hole would be a legislative activity, not an administrative activity.
But you'll be the Secretary of Health and Human Services, you will be doing a lot of work to prepare this legislation and to do the technical work behind it for the administration. Are you going to be proposing in that role something that reopens the donut hole? I've got a lot of seniors who want to hear about that if that's your plan.
I'm not aware of any discussions to do that.
Okay. And then finally, my recollection of that meeting and my notes are that you told me that you would not want to return to insurance company lifetime caps or insurance company denial of pre-existing conditions, or insurance companies going back and looking in the files for some little tiny discrepancy and then throwing somebody off their coverage when they come in with a significant claim. Is that true?
I think there are always ways that we can improve coverage, and those are areas that are existent right now, and I think they need to be the issues need to be continued.
So when, as, and if we ever get a Republican counterproposal to Obamacare, you would expect to see those things in it?
I don't know whether they'd be in it or whether they would be silent on it. But again, that's a legislative question.
They'd leave it in place.
Yeah, it's a legislative question, not an administrative question.
Now, in one of your budgets, you had a proposal that would allow states to throw what you called able-bodied people off of Medicaid unless they were working or looking for work or in job training. People with addiction, behavioral health, mental health issues, are they able-bodied in your definition?
Well, we weren't as specific as what the definition was. The fact
of
the matter is
that... You used the word, so I'm asking you now, what did you mean when you said able-bodied in this provision?
The fact is that there are many, many individuals who have worked in this space for a long, long time who believe that providing for an opportunity for individuals who are able-bodied without children to seek or gain employment or to study.
And what do you mean by able-bodied is the question. You just used that term again.
And that's what would be defined in the regulation itself. So I don't know.
You used the term without an idea of how you would define it?
I think people have an understanding of what able-bodied is, and that's somebody who doesn't have the kinds of things that you described, I believe.
So that was the simple answer to my question. Able-bodied does not include people who have addiction, mental health, and behavioral health issues.
Again, it's the work that would be done to develop the regulation.
I meant as you used the word. I'm not asking about in some future universe. As you use that term in your budget.
I think individuals that demonstrated that they were in fact having challenges that would preclude them from being able to seek work or employment or education or the like, that they ought to be attended to.
Now, I'm a fan of and think they do good work of the American Academy of Pediatrics. I'm a fan of and think they do good work of the American Lung Association. And I'm a fan of and think they do good work of the American Public Health Association. All of those groups and many others have gone very clearly on record that climate change presents significant health issues. They signed a declaration on climate change and health, which stated that the science is clear that this is happening. You, on the other hand, have said that the carbon pollution standards of the Obama administration, quote, go against all common sense, and that there are errors and obfuscation in the allegedly settled science of global warming. I'll pursue this with you through questions for the record because my time has expired, but if you could give a brief answer, because it appears to every scientific organization in the country, all the legitimate major ones, and to really every American university, that this actually is pretty darn settled science, and that the only people who disagree with it are people who have vast financial interests in preventing any work getting done. And it looks to me like in making this statement, you have taken the side of those vast special interests against actually settled science. And if we can't trust you on science that is as settled as climate science, how can we trust you on public health science issues where there's a big special interest on the other side?
I don't agree with the premise or the insinuation, but I will say that the climate is obviously changing. It's continuously changing. The question from a scientific standpoint is what effect does human behavior and human activity have on that, and what we can do to mitigate that. And I believe that's a question that needs to be studied and evaluated and get the best minds available to make certain that we're doing the right thing from a public policy standpoint.
Start by finding me a university that thinks the way you do. One.
Okay, we're running out of time. Thank you, Senator Whitehouse.